This is Dr. Andrew Jones. In this edition of Veterinary Secrets, you're going to learn how to treat your dog's cruciate injury with supplements, passive range of motion, acupressure, and massage. The next basic step, regardless of whether you've had surgery or not, but in particular if we're looking at conservative treatment for a cruciate injury, is supplementing your dog. You need to have your dog on adequate levels of glucosamine, chondroitin, MSM. And for glucosamine, we're looking at 500 milligrams per 40 pounds of body weight daily. For chondroitin, we're looking at a minimum of 250 milligrams per 40 pounds of body weight daily. For MSM, we're looking at 500 milligrams per 40 pounds of body weight daily. So those levels are in my supplement, Ultimate Canine Health Formula. It'd be great if you would get my supplement. Regardless, there's a number of very quality dog arthritis health supplements that have similar levels. The big point is you need to make sure there's adequate amounts of glucosamine and chondroitin and MSM. A number of ones, for instance, will have chondroitin in them, but they're not in therapeutic levels. So they need to be high enough and they need to be in those proportions. The big point about the supplement is we now have an unstable knee. Whether your dog has surgery or not, the knee will never be exactly the same. It's going to be altered in some way. Acupressure is another therapy that you should be doing at home, in particular if you're treating your dog conservatively for an ACL injury. There's 4 or 5 different acupressure points you should be aware of. First, we're going to focus on the knee itself. So just being aware where your dog's knee is. And here's the hock, that joint below the knee, the hip joint up here, here's the knee itself. Assuming your dog has ruptured it, it's very painful, so we're being fairly tender. What I want you to do is find the ligament goes on either side, and there's a bit of a depression. So we're finding the knee itself, and you can feel this band of tissue. So it's the patellar tendon, and it's running where it inserts right here on the tibial crest, straight up, and goes up above, and it actually attaches up on the femur. But on either side of that patellar tendon, just below the kneecap itself, there's a depression. And those are 2 key acupressure points. So you can use your index finger, your middle finger, and you can just put moderate pressure right in that area. So right over top of the knee, right either side of patellar tendon. And you can hold that for 30 to 60 seconds. What I suggest to clients is attempt to try acupressure for a week. And go ahead and do that twice a day. Do it in the morning and the evening. It takes you 30 to 60 seconds. The key with acupressure is you're thinking it's not traditional medicine, it's Chinese medicine. So we're dealing with energy flowing through different points within the body, called these acupressure points, and flowing along certain lines are called meridians. So in terms of visualizing and having your dog heal, you're actually imagining energy flowing from you through your fingers into your dog's knee, in through these acupressure points, having that energy flow normal. The thought is with Chinese medicine, the reason there is disease or pain is that there's an interruption in that energy flow. So in this case, because the ligament is damaged itself, then there's secondary pain and inflammation, and that's affecting the normal flow of energy. So by doing so, we're helping have that energy flow normally again. So as I said, on either side of the kneecap itself, holding that for 30 to 60 seconds. I'm doing that twice a day, doing for a week to see if it's beneficial. The next point, there's one here, is called the ST36 point. And it's a real common one for many people, that they'll actually find great pain relief from it. So what you need to do is just below the knee, you'll see this ridge. That's called the tibial crest. And that's this ridge of bone that just runs right along the top of the tibia. I'll also go ahead and show you the same point on the knee model itself. So the ST36 point is just lateral, so it's just on the outside, right in that depression, just adjacent to next to the tibial crest. So I'm just putting my index finger right on top of that. Same thing, holding that for 30 to 60 seconds. You want to put moderate pressure, visualize positive energy flow through you into that acupressure point, into your dog. There's the ST36 point. The next easiest thing you can do is just using your palm. It's called palm acupressure. So you can just put the palm of your hand right over top of your dog's knee. We know where it's sore and painful. And likewise too, just imagining this energy flowing through your palm into your dog's knee. Doing that 30 to 60 seconds twice a day. Then the last 2 points I want to show you are called the easiest ones to find. They're called the BL60, the KI3 point. So the BL60 point is found in here in this depression between Lewis's Achilles tendon, right in here, and the base of his tibia. And that's the BL60. The inside one is called the KI3 point. Those two can be held in conjunction together with your thumb, your forefinger. Hold them. They're great ones in general for dog pain, period. In particular, if we were dealing with sore knees, we're dealing with sore hips. First, we're locating the points on either side of the kneecap, or the patella and the patellar tendon. They're right here. So this is the big patellar tendon. Yeah, your middle finger, your forefinger on either side. And you're putting that moderate pressure 30 to 60 seconds twice a day. Then the ST36 point, so what you're finding is this ridge bone here, this is called the tibial crest, that bone there. And that ST36 point is right in here. It's just, you're dropping down almost at the end of the patellar tendon, and you'll actually feel this depression just on the outside of that bone. And this bone is this ridge bone called the tibial crest. So right in there. And similarly, you're holding that for 30 to 60 seconds twice a day. Now I just wanted to show you some passive range of motion exercises. So with Lewis, once again, if we imagine it's his left leg that he's injured, and he's got an ACL injury, find a comfortable spot in the carpet or something. Relax your dog first. So they're feeling fairly comfortable first. I want you to be very gentle with the knee, especially if you're not done surgery. We're going for that really strict full 8 weeks where they can do nothing. Like you've really restricted their activity. What we want to do is make sure that these muscles don't contract and they still have their range of motion. It makes a big, big difference if we're going to have a good long-term success and you're not going to have a chronically lame dog. So what that means is just moving those legs up and down gently while you're supporting the knee, going through that range of motion. So as one here, as you can see here, I'm holding Lewis's left knee up with the palm of my hand. I'm grabbing onto the back of his leg, his hock. I'm just extending and I'm flexing it. You could look at doing something like 20 of these. Extend and flex. Ideally doing that morning and night. And you want to go just enough. You don't want it to be painful either way, but you want those legs to extend and flex. After you've done the range of motion, extension and flexion with the knee, you can look at doing something similar with the hip. I just want to make sure that you're protecting that knee, you're gently holding the leg up, because we don't want to harm your dog in any way. Don't want to cause a drawer sign. That scar tissue is forming. And I'm just flexing, extending and flexing his hip joint. So we're going through the range of motion with his hip muscles too. The first part of the massage is you're trying to warm up Lewis's muscles or your dog's muscles. So I want you to use effleurage. And that's these sort of long, slow strokes, starting out by your dog's hip joint, going along the side here. I'm going along the side, the front part of his legs. We're going these big quadricep muscles along the side, gentle over the knee, on top of that big muscle belly below the knee, that big cranial tibial muscle, down towards his hock joint, towards his toe. But we're just, these gentle, long, slow strokes, maybe slowly increasing in amount of pressure. Along the back here, working on his glutes, along the back of his leg, the back of the knee, down towards his toes. Then the next part is I'm just going to have you do gentle palpation with your thumb and your forefinger. Starting up here at his hip joint, all around the ball of the point of the femur here. Feeling, first you're loosening up those big muscle bellies, or you're loosening up those quad muscles, and you're feeling for any particular knots. If you find one, if you find a little knotted muscle, you can hold that for 30 to 60 seconds and release. But the big point is I don't want you having to spend a lot of time, but we're just making your dog more comfortable, less pain-free, making sure there's no other reason for him to be in pain. And we want to make sure that he can have more than adequate blood supply that is going to flow towards that injured knee, so that knee can heal in the quickest time possible. The last massage technique is one that is more used with people, and we're dealing with a thing called this IT band. So the IT band is the band of tissue that's running from a wing of our ilium, that's the outside part of our pelvis here, down the side of our leg, down to our knee. So it's running up here, the outside of Lewis's pelvis, down the center part of his, along the back part here of his femur, inserting down here up onto the tibial crest, down here. This band of tissue in here. And what can happen is that can become especially contracted and tight. And that's preventing this normal range of motion. So in some cases, just use the center of your fingers, running it down here, right along the middle of your dog's, right on top of the point of his femur, straight down towards his knee. Kind of loosen up that IT band. And then the next thing you can look at doing is using a foam roller if you happen to have one. So here's one here. That's what I use on myself. And you can just roll that roller, right? Just along, you're starting at Lewis's hip, straight down to his knee. And if you've got a dog that has an injured ACL, you have to be especially cautious. But what you're doing is you're not pushing on the knee itself. All you're doing, you're pushing on that muscle belly, starting up here at his femur, his hip, stopping right at his knee. I wanted to mention the huge benefits that can come from swimming. Great if you're dealing in sort of the spring, summer, fall, or you have access to water. Of all the different exercises that can supportively help your dog heal, have him go through the range of motion as far as moving his knee, but not cause any damage in any way as swimming. Thank you for watching this edition of Veterinary Secrets. What I want you to do now is click that link above. You can subscribe to my channel, and then when you sign up for my newsletter, I can send you my free books and videos on how to heal your dogs at home with my top natural remedies.